Hi everyone, this is John. Welcome back to another episode of the Subcontinent. Through this show, we aim to address a few of the most important issues in South Asia. We'll be getting views of the public and experts for an in-depth insight of the situation and go on ground to see what the reality actually is.
In this edition of the Subcontinent, we will be reviewing the problem of water scarcity in India. And we shall see how coronavirus has affected Pakistan.
Experts say that if India does not address its water scarcity issues in the next 5 years, it will reach a national water security crisis. This is a huge problem because most of India's groundwater resources are used in water-intensive crops such as rice and cotton, which are two of its main agricultural exports. As a part of the election promises, Prime Minister Narendra Modi promised to provide all homes in the country with piped water by 2024. Critics say that this initiative focuses merely on infrastructure of no real benefit. It begs the question, what use are the pipes if there is no water?
India's population is outgrowing its total water supply and nature is having a hard time keeping up. Already, over 600 million people across the country suffer from severe water shortages as groundwater resources are rapidly depleting.
We get water for 3,000 rupees every month. And it's not just my home, the whole neighborhood is having the same problem. In summers, the situation is worse.
Groundwater makes up 40% of the country's water supply, which is mainly used in agriculture. Taps have already run dry in Chennai, Bengaluru and Hyderabad, among others. The lack of water will affect India's food security, vulnerable populations, and increase disease due to sanitation. Moreover, India will have to face interstate regional conflicts over water access. Notwithstanding India's internal water struggles, its transnational water supplies provide the remainder of its needs. Also, it is possible for India's water crisis to provoke existing tensions among its neighbors, with hefty consequences for regional stability. Water diplomacy is a global tool used to pressure other countries. For instance, India has threatened Pakistan at times that it will leave the 1960 Indus Water Treaty. This treaty was signed as a response to the 60-year dispute of the Kashmir region, which is greatly entangled with water security.
India's water mismanagement has grave consequences. Hundreds of millions of people do not have access to safe water. The drought in 2019 affected more than 500 million people living in at least 10 states, and Chennai, India's sixth largest city, ran out of water. Just last year, World Resources Institute ranked India 13th among the 17 countries where water stress is extremely high. It won't be far-fetched to see that India will use more water diplomacy in the years to come if it does not find local measures to fix its situation.
India also has water disputes with China. Pakistan is third among countries facing water shortages according to the International Monetary Fund. Also, the Indus waters provide fresh water to 90% of Pakistan's agricultural industry. For example, in 2016, India alleged that the Pakistani militants were responsible for attacks on Indian army personnel in the Kashmir region, which nearly caused India to tear up the Indus Water Treaty and hold water to ransom. Some political analysts say that India will not act on threats to cut water supplies to Pakistan because of China. Many rivers into India are fed from China further upstream, and China has been watching the India-Pakistan water tensions closely to see what decisions India might make. A pivotal issue will be whether India can obtain its water requirements without further aggravating conflicts with its neighbors. Otherwise, increased competition and the possibility of aggressive confrontation will be other cards on the table. These issues present a considerable risk for India's steady socio-economic rise, as well as the security and stability of broader regions. Water will continue to be a critical aspect in regional development for all countries involved.
For more analysis on this issue, we are now joined by Dr. Ashok Swain. He's a professor of peace and conflict research at Uppsala University and the UNESCO chair on international water cooperation. Dr. Swain, welcome back to the show. It's nice having you again. So, Prime Minister Modi made promises to provide every household in India with piped potable water by 2024. How will the government ensure that the water will flow in the pipes when vast regions in the country are running dry?
I think that's quite important to realize that India is facing serious water crisis. Of course, the present regime wants to provide the water to everyone in the country, and I think piped water, and it's a good thing to do. But the reality is that whether, as you said, whether the water will be in the pipe or not, because there is no water. And then this would be again an infrastructure without the key ingredients which will make it useful. Like the same regime has been building the toilets all over the country, but there was no water in the toilets. And now you put the pipe, and then there is no water in the pipe. And I think it needs much more comprehensive, much more careful approach of how to provide the water to the people. Not only building infrastructure, you need to create institutions, you need to create legal measures, you need to create social measures, and it's a very comprehensive way of providing water. You can't just build the pipe and expect the people to get the water.
So, in light of tensions with China, do you think that India will continue to use water diplomacy to put pressure on neighboring Pakistan in the name of border security?
You see, the water is being used not as a diplomacy, but as a threat to the Pakistan since 2016, at least by the present regime. The question is, I do see that the process will continue, that the threatening to stop the water supply to Pakistan. But the question is, the reality is, Indian government can't do much about stopping the water to going to Pakistan, because the three western rivers of Indus system, which go to Pakistan, they cannot be stopped because they are from the Kashmir Valley. They go directly to Pakistan. So, and you need to build big dams which is not allowed within the Indus Treaty, which they have signed in 1960. So, these are all empty threats are being given by India in present regime, but I think it will be not possible for them to execute these threats, particularly because of the geography and the military balance will not allow it to do so.
Dr. Swain, I'd like you to see how the global and regional media have covered this situation, and then we can come back to the question and answer session. Please stay with us.
With nearly 50% of India grappling with drought-like conditions, the situation has been particularly grim this year in western and southern states that received below-average rainfall. The anger over water scarcity is palpable at a farmers' protest in Darodi village in the Indian state of Haryana. Thousands of protesters demanded clean drinking water for nearly a month and a half. With tensions between India and Pakistan after an attack in Kashmir, New Delhi decided to retaliate in part by cutting off some river water that flows downstream to Pakistan. India has a water dispute with China on Beijing's construction of dams and proposed diversion of the Brahmaputra River, which originates in Tibet and provides a third of India's need for irrigation.
All right, thank you, Dr. Swain, for being with us, and welcome back to the audience. So, Dr. Swain, some experts say that if India does not sort out its water crisis in the next 5 years, hundreds of millions of people will be in danger. So, just how bad is India's water crisis right now?
It's extremely serious. India is going through a serious water crisis. The problem is much more serious than what it was thought before. Even the Indian government's own agencies are saying it's a huge crisis is there. And I think the real issue is that because Indian government hasn't really, the present and even the previous ones, they have not really been taken this water crisis seriously. It's also a very global problem. Globally, water was not being taken seriously, that it will go run out like this. So I think it is a very serious problem India is facing, and the issue is that in order to face this problem, what are the options you have? The kind of options Indian government is taking up to meet this crisis, which are absolutely ad hoc in nature, mostly infrastructural. We are looking at only the supply side increase while not really looking or trying to bring more reuse of the water or demand side decrease. So I think it's the threat is real, but the real problem is that the government or regime's response haven't been adequate or even good enough.
All right, Dr. Swain, lastly, many studies have shown that global warming and climate change have been big contributors to water shortages around the world. What steps has India taken to reduce its water footprint and environmental pollution?
I think there have been, this is a global problem. Climate change is bringing water crisis all over the world. The certain areas will get more water, certain areas will get less water, but depending on which kind of basin, where you are. So there will be the major problem due to climate change is the water variability, because it will not be the business as usual. The question is what Indian government has done. Indian government actually hasn't really taken any concrete measures towards protecting its water supply or securitizing its water supply for the people. So I think what has happened is there have been some climate change related actions have been like creating green energy, that sort of stuff. But how to protect and preserve the water supply and to the pollution and its pollution, there is very little Indian government has engaged in. So I think, unfortunately, India's response or India's preparedness to face the climate change, particularly in the context of water supply, is absolutely disastrous.
Thank you so much, Dr. Swain, for being with us on our show again. Now, viewers, let's see how social media has been on this situation and how people have voiced their opinions online, and then we can continue with the rest of the show.
CNN shares a short clip of showing the water scarcity in the city Chennai. Let's just take a look at it. Mentioning the doctoral aspect of the water scarcity, Eric Solheim expresses his concerns about this major problem. Regarding the different environmental crises, Advaid reminds us that we are all responsible to provide our children with suitable environmental conditions. Siksit Bhatta believes that India is going to face water shortage crisis in the next 10 years, and by mentioning some facts, he considers the diplomatic way as a useful tool for solving the problem.
Pakistan just can't catch a break recently. With its economy grinding to a halt, COVID-19 is wreaking havoc in the country. Early on, the government implemented measures to contain the spread of the virus, but the disease has spread like fire. The good news, however, is that the government says it has thousands of ventilators available, and Pakistan has even started producing its own ventilators. The death toll is relatively low so far, but the real question is, can Pakistan's healthcare system really accommodate the infected people?
Coronavirus has been ravaging Pakistan's already weak healthcare system. The situation is so dire that since the country came out of lockdown in May 2020, at least 100,000 new cases of COVID-19 were recorded, and the daily death toll rose to 150 people per day. Hospitals and healthcare workers are turning away patients by the droves, saying that there is just no more space for new patients. Also, supplies have nearly dried up and hospitals are running out of crucial medicine to treat patients. In other places, there is no medicine at all. Many are forced to search for ventilators and oxygen tanks as hospitals have none to spare. Patients are turning their anger on doctors and healthcare workers with violence and desperation. Healthcare workers and doctors are falling ill at an unprecedented rate. The country already has a struggling economy and could no longer sustain a longer nationwide shutdown due to the pandemic. Pakistan's healthcare system has been severely overburdened, and the virus has caused devastation and rising panic across the country. As of late June 2020, there were over 200,000 COVID-19 infections in the country, with over 4,000 deaths.
Smart lockdowns are now being implemented across the country because of the rising coronavirus cases. But how do we know how many people have been affected or even died because of the virus? Where public hospitals do not have proper health infrastructure, most private hospitals are charging an astonishingly high fee for testing and treatment. Much like in many other countries of the world, most people in Pakistan are simply not following any precautionary measures. Pakistan cannot afford a nationwide lockdown because the economy risks getting collapsed. So the only way to fix this problem is if people listen.
The World Health Organization, WHO, has placed Pakistan in the top 10 countries for the rise of the virus. Earlier in June 2020, WHO urged the Pakistani government to alternate between 2 weeks of lockdown and being open. The spike in COVID-19 cases had devastating effects because of the premature reopening of the nation. Later, the government of Pakistan announced that it had rejected WHO's proposal. Islamabad has gone forward with opening up the country in a bid to salvage a near collapse of the economy, where millions have already fallen below the poverty line due to health costs and restrictions from the pandemic. The government of Pakistan requested an emergency loan of $1.4 billion from International Monetary Fund (IMF) to help the country mitigate its economic struggles owing to COVID-19. Most are not able to pay for private healthcare treatment at hospitals. Both private and public hospitals are severely overburdened with the surge in coronavirus-related cases. With fewer than 3,000 acute care beds for the fifth most populous country in the world, healthcare workers and doctors say the system is tiptoeing catastrophe.
To learn more about this issue, we are joined by university professor and commentator, Mr. Syed Inamur Rahman. Professor, welcome to the program. How has the government responded to those who have fallen below the poverty line and needed financial healthcare assistance?
The government of Pakistan on emergency basis started different programs, announced a certain amount for those people who were working on daily wages basis. And especially in healthcare, the government, especially federal government and the provincial governments, has issued a health card. And those cards are very effective, and those people who need health assistance, they use those cards, so there is no worry of financial support at that time. But during this pandemic, all the organizations were actively engaged to reach to those people who even can't afford to reach a hospital or to attend their the person who were the victim of this disease. So the government and the philanthropist organizations, they were very active, and now even internationally people appreciate the government efforts, different organization efforts in this regard. And one important thing is there are people who are from Afghanistan, so they have no record to reach with them. Here they announced that you provide a certain number, you will provide your identity card on that number, and then we'll reach to you for providing certain amount. But those people who had no documents, it was difficult for them to reach to them and provide them assistance. But there are some organizations like NGOs and other organizations, they provided assistance to those people who had no documents, like the people of Afghanistan who have been living here for the last 30 years.
Mr. Rahman, please stay with us so that we can see how the media have covered this situation, and then we can continue with the question and answer session.
The World Health Organization is urging Pakistan to impose a 2-week intermittent lockdown to stem a spike in new cases. The number of people living in poverty has risen to 40% from 30% since the pandemic began, and massive job losses potentially will spark unrest. Although government officials never ordered a countrywide shutdown, most Pakistani provinces were under strict measures until early May. Prime Minister Imran Khan said those efforts created an unprecedented situation in the economy that cannot be repeated. Pakistan has a ratio of 1 doctor to 963 people and 1 hospital bed to 1,608 people. Its shortage of trained medical staff is estimated at 200,000 doctors and 1.4 million nurses, and universal health coverage is non-existent.
All right, Mr. Rahman, thank you for staying with us, and welcome back to the audience as well. So, Pakistan has received international relief and medical supplies from other countries. How beneficial has this aid been in the current situation?
No doubt, because the presence of this pandemic is everywhere. So many countries, developed countries, our neighboring countries, China, they provided lots of support, and alone the government or we the people were unable to cope with this situation. And the people of Pakistan, the government appreciated this assistance, and I think this process is still continuing.
Okay, so lastly, how has the epidemic in Pakistan affected prices of personal protective gear? Is the government providing healthcare workers with these supplies?
Yes, this is quite natural that when the demand increases, the price also increases. But with the passage of time, you know, Pakistan is a textile country. They started preparation of masks and other things. So now the things are very much available on the low price. But in the beginning, it was observed, and it was like an emergency situation. The people would search for these things in different areas, and these were not available. But now it is available. And now we watch or we read in the media that all the health professionals which are busy in treating this disease, they are well equipped, and there is no problem of provision of such stuff to these professionals.
All right, thank you, Mr. Rahman, for coming to our show and sharing your opinions. Viewers, let's see how people in social media have voiced their opinions on this issue.
According to Omar Qureshi's tweet, 4/5 of the COVID-19 cases in Pakistan have recovered. Also, in another one referring to the recent statistics, he addresses that Pakistan has witnessed a 47% decline in the number of the active cases of COVID-19. Comparing the capacity of conducting tests between the US and other countries, including Pakistan and India, Fahim Yunus warns about the actual number of cases in these countries.
That's all the time we have for today. We'd love to hear more from you, so check out our social media platforms and send us a message or leave us a comment and let us know what you think about the show. See you same time, same day next week. Thanks for watching.